Hello, it's me, Demetria Rutledge, your community NP. Today, we're going to talk about a blood test called a CBC with differential. If you have your MyChart or patient portal available and you have a CBC with differential, then welcome along. I'd like you to follow along as I review the basic components of your CBC. CBC stands for complete blood count. This test helps providers understand what's going on inside of your blood. Think of your blood as a team. Each part of the team has a special job. First, let's talk about red blood cells. The red blood cells carry oxygen from your lungs to the rest of your body. Oxygen gives your body energy. The red blood cell count tells us how many red blood cells you have. If the number is too low, you might feel tired or weak. If it is too high, your blood can become very thick. Next is hemoglobin. Hemoglobin is the part of the red blood cell that actually carries the oxygen. Low hemoglobin means your body is not getting enough oxygen, and that can make you feel dizzy or exhausted. The hematocrit tells us how much of your blood is made up of red blood cells. If it is low, you may not have enough red blood cells. If it is high, your blood may become too concentrated. Next, we look at something called MCV, mean corpuscular volume. This is a big name, but it simply means the size of your red blood cells. Small red blood cells often mean low iron, when large red blood cells mean B12 or folate deficiencies. Next is MCH, mean corpuscular hemoglobin. This tells us how much hemoglobin is inside of each red blood cell. If the MCH is low, the red blood cells may carry less oxygen. If your red blood cells carries less hemoglobin, then you will be tired. MCHC means mean corpuscular hemoglobin concentration. This tells us how much packed is your red blood cells inside of the hemoglobin. You can think of it as MCH is how much hemoglobin is in the cell, and MCHC is how strong the hemoglobin color is. Low MCHC can happen when red blood cells look pale, often from low iron. Then RDW, red cell distribution width. This tells us if your red blood cells are all about the same size or if they're different sizes. A high RDW means red blood cells are not all the same. White blood cells. Now, this means how your body fights germs. The white blood cell count tells us how many germ fighters you actually have. High levels mean that there is infection or inflammation in the body, like low levels mean that it's harder for you to fight germs. The differential tells us what type of white blood cells are in your blood. Each type has a different job. First, let's talk about neutrophils. Neutrophils fight bacterial infections. They are usually the first to show up when you're sick. High neutrophils often mean a bacterial infection. Lymphocytes help fight viruses and remembers the germs in your body as you've seen it before. High lymphocytes often happen when there's a viral infection. Now, monocytes. These help clean up the dead germs and damaged cells. They often increase with long-lasting infections or inflammation. One of my favorites is eosinophils. Eosinophils helps with allergies, asthma, and even parasites. High eosinophils often means allergies are involved. Last are basophils. Basophils help with allergic reaction, and they're usually present in very small numbers. Now, let's talk about platelets. Platelets help your blood clot when you get a cut. Low platelets can cause easy bruising or bleeding. High platelets can cause increase in the risk of blood clots. MPV stands for mean platelet volume. MPV tells us how big your platelets are on average. MPV is the average size of platelets, like checking whether your body is making newer, bigger platelets or older, smaller platelets. So, to review, red blood cells carry oxygen. White blood cells fights germs. Platelets stops bleeding. Remember, a CBC with differential provides providers the information we need to address infection, anemia, immune health, and overall wellness. Think of it like your report card for your blood. I encourage you to purchase my basic preventative lab guide. The cost is $10. I will place the description in the link. Please subscribe to my channel for more educational videos. Think about this. The next time you go to the provider's office, you will have more knowledge and be able to ask more questions, especially if you have concerns, because knowledge is power. Thanks for watching. Bye.